11 in the name of Deputy Desi Ellis.
Thank you, Caherlock, and thank you to Deputy Ellis for the question. In January 2015, my predecessor introduced maximum permissible waiting times for inpatient and day case treatment and outpatient appointments of 18 months by the 30th of June and 15 months by year end. Additional funding, as the House will know, of €51 million was approved in 2015 to maximise capacity across public and voluntary hospitals, as well as outsourcing activity where capacity was not available to meet patient needs. HSE figures for the end of December 2015 show 95% achievement for inpatient and day case waiting lists and 93% achievement for outpatient waiting lists against the 15-month maximum wait time. The HSE has advised me that €28 million of the funding provided was utilised last year in 2015. Expenditure on this initiative has continued into 2016 in respect of those patients who had been referred for appointments in the latter part of 2015, as well as those who had commenced treatment which could not be completed before year end. In addition to the almost 40,500 patients who have already been treated under the 2015 initiative, there are currently 700 patients who are in the process of completing their episodes of care. The HSE has provided assurances that all episodes of care are to be completed by the 20th of June and that all treatment providers have been apprised of this deadline. Final expenditure on this initiative will be available after that date, after the end of this month, once all episodes of care have been delivered. The outcomes of this initiative will inform the implementation of the Programme for Partnership government commitment to provide €50 million per year to reduce waiting lists, inclusive within that a sum of €15 million, as I discussed earlier on, for the National Treatment Purchase Fund. And I will be considering in the context of Budget 2017 how best to utilise that €50 million to tackle waiting lists, inclusive of the €15 million, and I'll await the end of this period of care at the end of this month in terms of how to best evaluate that.
O'Reilly.
Thanks, Minister. The National Treatment Purchase Fund that's just code for privatising a problem. We don't support that. We support investment in our public health service. Can you advise how, if there is 50 million of continued investment, I think is how it's termed, per year, but the ministerial brief given to yourself advises that there was only €28 million of funding spent in 2015. So clearly there's a deficit in those figures. And can I ask, was this primary funding or additional funding? And just in terms of exactly what the money is getting spent on, exactly how many episodes of care did this cover for the year?
Sure. Well, firstly, just in reference to your comment about the public health service, I fully support the public health service as well. I want to see investment in the public health service. I want to see the committee we set up yesterday devise a vision, a plan and funding costs for how to get that public health service to the place we all want it to be over the next decade. But I also recognise that at times when there's people at home, people who could be watching our question session today in need of an operation where perhaps the capacity doesn't currently exist within the public health service, I recognise the NTPF, as a useful vehicle in which to go down that route. In relation to we'll disagree on that, but that is very much my position and that of the government. In relation to the 50 million, 51 million was provided in 2015, as I was outlining, and you're correct in terms of the ministerial brief. Some of that has spilled over in 2016 in terms of the pay. The 50 million referred to in the programme for government isn't something that would have been available in my ministerial briefing, as it's a commitment, a political commitment by me and by the programme for government to allocate €50 million in the budget. So I expect when we're delivering the budget that €50 million of the health budget next year will be allocated to waiting list initiatives. And I was saying to you, I'll be looking at how best to outline that. I'll provide you with some of the figures when I come back in.
Thank you. Question number 12 in the name of Deputy Brian Stanley.